Good afternoon, all my dear students. Today we will discuss the new topic, the classification of general anesthetic. Classification of general anesthetic. There are two classes. The first class, it is divided into two classes. The first, inhalation. Inhalation anesthetic. Generally known as volatile anesthesia is a volatile. Inhalation again is divided in the subclass. First, gaseous anesthetic. They are used in the gaseous. A very common example, nitrous oxide. It is also known as a laughing gas. Another example, cyclopropane. B, the volatile liquid. Volatile liquid anesthetic. Example, halothane. Most common example, halothane. It is used for short surgery. Enfurane, isofurane, methoxyfurane, ether. And the second type, intravenous anesthetic is also known as non-volatile. Again they class divided in two types. First, ultra short acting barbiturates. Example, thiopentone sodium. Hexobarbitone. B, non-barbiturates, second class. And the example, ketamine is belonging to derivative of phencyclidine. Diazepam is belonging to the benzodiazepine classification. The example of benzodiazepines, lorazepam. Diazepams and the lorazepam is belonging to the classify the benzodiazepines. Ketamine is derivative of the phencyclidine. Clonidine, it is alpha 2 adrenergic agonist. Fentanyl it's upward analgesics. Now, classification of general anesthetics, there are two class. Inhalation anesthetic, generally it is the volatile. Volatile means it is a vapor at a room temperature. They are evaporated. Now it can again divided two parts. The gaseous anesthetic, example it's nitrous oxide. It is also known as a laughing gas. Cyclopropane, another example of gaseous anesthetic. Inhalation again divided as second type, volatile liquid, halothane, N-furane, isofurane, methoxyfurane, and ethyl ether is most common example of volatile liquids. Okay. Now the second class, intravenous anesthetic, is also known as a non-volatile anesthetic. They again further classify two types. Ultra short acting barbiturates, example, their duration is very short. They also call as a short acting anesthetic. Example, most common example, thiopentane sodium hexabarbiturate. Another class is a non-barbiturate, ketamine. Ketamine, it is a derivative of the phencyclidine. Diazepam, lorazepam, it's belonging to category of benzodiazepines. Quinidine is having the alpha-2 adrenergic agonist. Fentanyl, it is a upward analgesic. Now these are the drugs are used in the classification of general anesthetic. Now we can discuss the halothane. Now discuss the halothane. Now halothane, it is belonging to the volatile. It is a volatile liquid. Now volatile liquid, their property, it is colorless. First, it is colorless. It is colorless, having sweet odor, it is having the property, it is non-irritant. Their property, ideal anesthetic is having the properties, it is non-irritant, non-inflammable, non-explosive, Now it is halothane, it is very most potent anesthetic. It is more potent anesthetic. Generally it is used in the combination of 2 to 3% of oxygen. It is used for entire range of operation. All type of operation it is used. Halothane are used. Entire range of operations require the anesthesia. It's having the property, it's relax the bronchial smooth muscle. And hence it is a choice of, due to that, and hence it is a choice of asthmatic patient. Sometimes I ask the questions, why they are choice of asthmatic patient. It is colorless, sweet odor, it is non-irritant, non-inflammable, non-explosive. It is the most anesthetic. Is combination used in the 2 to 3% of oxygen. It is used for, halothane are used for entire range of the all operations require the anesthesia, and its a major advantage is they relax the bronchial smooth muscle, and it's a halothane is a choice of anesthetic patient. Halothane is a choice, of asthmatic patient. Now it's having some limitations. Halothane having some limitation because it is expensive. Halothane having the limitations. Which are the limitations? These expensive. It's very costly. Expensive. Poor analgesic. Does not produce. It's a poor analgesic. Does not produce the adequate muscle relaxation. It produces hypotension. That is a major disadvantage. And depression. Depresses the respiration. Depression of respirations. Now, these are the limitations. Limitation means is expensive. Major disadvantage. It is a more expensive. Poor analgesic. It causes hypotension and depression of respirations. And sensitized to the heart by catecholamine. Another limitations. Now it is a contraindicated. Contraindicated, it is never used for such a condition. It is contraindicated. It is contraindicated for during the labor, and it is not used in the hepatic or biliary disease. Hepatic, jaundice, hepatitis or biliary disease, never is those having the liver problem and liver disease. Such patient not use the halothane. They are called the contraindicated. It is also cause the hepatitis. It causing hepatitis. Hepatitis, frequently repeated use of halothane. Now you can use the halothane frequently. Repeated use, they cause the hepatitis. Now currently halothane is most popular. Currently, halothane is most popular because of their non-irritant, non-inflammable, non-explosive, and it is having the pleasant and rapid action. That's why halothane is most popular. Okay. Now next drug is enfuran. Enfuran, same property. It is non-inflammable, non-irritant liquid, similar to the halothane. Similar to halothane, but it is having the good property. It is a better muscle relaxant as compared to halothane. Better muscle relaxant as compared to the halothane. Uterine relaxation is more than the halothane. Uterine relaxation more than the halothane. It is contraindicated. Enfurane is contraindicated for the epileptic patient. Those patients having the epilepsy, convulsion, seizure, that patient is never used the Enfurane. They are contraindicated of such conditions. It is most expensive. Is having the it is most expensive. India is having the high cost, and it is commonly used in the well-developed countries. Okay. Now the next. Next are the chloroform. The chloroform, it is a volatile liquid. There is a property. Volatile liquid. At room temperature they are evaporated, and it's having the most powerful. Chloroform is having the most powerful anesthetic effect. But chloroform having severe toxic effect on liver and heart. Hence it is not used. Nowadays it is not used because of the having the serious toxic effect. Most vital organ in the body, liver and the heart. That's why nowadays not used. Now next is ethyl ether. It is safe. Most efficient anesthetic. It produces muscular relaxation. The ether induction is slow. But margin of safety is large. But is having the drawback. Its drawback is irritant in the nature, irritate the respiratory passage. Respiratory passage, and is inflammable, very dangerous, inflammable. Due to that, their use should be the decrease. Okay. Now next the intravenous anesthetic. Intravenous anesthetics. Now intravenous anesthetic mainly are used. It is for the rapid induction. Is having the rapid induction of anesthesia. Rapid induction of anesthesia, which is maintained by inhalation process. It is used for the short surgery, diagnostic Their example is barbiturates. Then barbiturates having the ultra short acting thiopentone sodium is the example. It is used for the short surgical procedure operation. Induction should be in the very rapid. In the second, induction is rapid. In the second, it's having the thiopentane sodium is having the over analgesic, weak muscle relaxant, it's there the drop back. Okay, now the dose is used for 3 to 4. Commonly the dose is used for 3 to 4 mg per kilo as 2.5% freshly prepared. Solution. Total dose should be the 1 gram. Thiopentane sodium total dose is 1 gram. Intravenous, their adverse effect. Intravenous barbiturate cause their adverse effect is laryngospasm. Larynx should be having the pains. They cause spasms. Overdose of intravenous cause respiratory arrest. Now, next example, non-barbiturate example, ketamine. Now, ketamine, it is a derivative of phencyclidine. Derivative. It is also called as ketamine is also called as dissociative anesthesia. Ketamine, there is proud of the analgesia, immobility, light sleep, and feeling of dissociation. Another is minimum side effect. Respiration and CVS. Ketamine commonly used for children. asthmatics, or it is used in severe hemorrhage. Severe hemorrhage. It is used for the surgery, hand, neck, for short procedure. It is also used in the burn. It is not useful in the epilepsy and the hypertension patient. It is not useful in hypertension and epilepsy patient, those suffering from the epilepsy. It causes the side effects hallucination, we call the avas, excess salivation, saliva secretion is increased, vomiting, overdose is caused vomiting and skin rashes. See, the ketamine is derivative of the phencyclidine derivative. It is also called as distributive anesthesia. There is a profound of analgesic, immobility, light sleep and feeling of dissociations. They are having the minimum side effect respiration and serious. Commonly used in the children and the asthmatic patient. It is also used in the treatment of severe hemorrhage. It is used for the operation of neck and the hand, and it is also used in treatment of burn, neck and hand operation. It is never used the patient is having the hypertension and those suffering from the epilepsy. They cause the side effects, hallucinations, excess salivation, vomiting and the skin rashes. Now this chapter is closed. Stop.